Welcome to the Fierce and Fit Mentor Podcast. I'm your host, Clarice Yao, a holistic health coach dedicated to helping women over 40 achieve their fittest, fiercest selves. Each week, we'll dive deep into the unique challenges of menopause, including belly fat, weight gain, muscle building, hormonal imbalances, and more. These episodes are recorded live from my free Facebook group, Fierce Women Sculpting Powerful Bodies and Champion Mindsets. Be sure to check the link in the show notes to join our incredible community and access free content, challenges, and resources designed just for you. This live's topic is hormone therapy, yay or nay. And this is live number 224 that I have done so far. This is a very controversial topic, and of course I knew that. And as soon as this went out, a lot of the messages coming back, there were people say yay, some people say nay, and some people are like, it's all over the place. So the first thing is to understand that this is a controversial topic, but for good reason. And of course, I'm going to try to help clarify some of the confusion as well. Who here actually is taking HRT or may be considering taking HRT? So put your vote below, or let me know. Are you taking HRT? Are you considering taking HRT? Kind of where are you falling in regards to this? Okay. This is a disclaimer if you're just popping in here. So the first disclaimer is I am not a doctor. My sister is, my brother-in-law is, we come from a medical family, but I am not a doctor. I am a health coach, a holistic health coach. This is really important because I want to make sure that you guys understand what I'm going to do on this live is help you understand about HRT, the pros, the cons, the misunderstandings, and where you can understand it better for yourself, okay? I believe that there is not a straight yes, no, but you have to consider a lot of context. And that's what I'm going to help you with understanding, as well as understanding what lifestyle factors can you do to help yourself improve in this situation. So this is part of the series and part of my community, the Fierce Woman community, Sculpting Powerful Bodies and Champion Mindsets. We are in the midst of building something really new, really, really exciting. And the more I'm building it, the more excited I am. I mentioned this last few calls. If you don't want to miss this announcement, it's coming soon, but of course, we want the best things to be coming out. So it's taking a bit more time, but if you don't want to miss this announcement for this new, community, new challenges, we're revising everything in some of our challenges, everything. You don't want to miss that, then make sure you put challenge below. Okay. And then we have a list going of all the people who told us they want to know about this new launch we're doing in the next few weeks. Okay. So we're going to start into this. So the first thing I'm going to say here is many women ask me, should I go into hormone therapy? Should I take it? Should I not? And the thing is, there's a lot of confusing information out there because it is a highly controversial topic. Doctors, media, online opinions, there's a lot of different things that could contradict each other. But if you actually really look more into it, it's that there's a lot of nuanced things that you have to consider, sort of like age and like WHI, the Women's Health Initiative back then indicate, I'm going to go through this, what was the problem with that type of trial? What's the difference between synthetic hormones versus bioidentical hormones? So there's a lot of things, nuance that needs to be considered. That's why there's a little bit of that controversy. And till this day, at this moment, it is still being debated in the medical community, but things have improved a lot in regards to the hormone therapy situation. Yes. So I'm going to help you guys understand. Basically, I'm not here to tell you whether hormone therapy is good or bad. I'm here to help you understand how and what to think about, what it does, where does it help you? Where does it carry the risk? And what lifestyle things can you do? Okay. So what is the definition of hormone therapy? Hormone therapy, often called menopause hormone therapy or hormone replacement therapy, HRT for short, is using estrogen with or without progesterone and sometimes testosterone to treat symptoms caused by declining hormone levels during perimenopause or menopause. Okay, it is usually prescribed to help relieve vasomotor symptoms like hot flashes, night sweats, genital urinary symptoms like vaginal dryness, painful sex, and bone loss, and sometimes even minor sometimes like brain fog and stuff, but that's still being researched, okay? But it's a lot of the symptoms that you start to feel in your maybe 40, 50, 60s, worse probably in your 60s, is why people consider going on HRT. As I described those symptoms, anybody have those? Can you guys put that below? Who has hot flashes or night sweats here? Or who might feel like they have brain fog, or, maybe vaginal dryness, maybe bone loss, put it below. What are some of the symptoms that you experience? Okay, so let's actually dive into kind of the types of broad therapy types, okay? So there is estrogen only, and then there's estrogen and progesterone. So we're going to talk a little bit about this, right? So if it's estrogen alone, it is for women who don't have a uterus anymore. They've had a hysterectomy, because estrogen itself thickens the endometrial lining, uterine lining. So if you don't have a uterus anymore, you don't have to worry about the thickening of the lining, which is usually maybe more closely connected with some cancer risk, okay? And we're going to get into that. There's a lot of research and debate on the cancer and all that type of stuff. But this is the thing, is if you have no uterus and you've had a hysterectomy, then it's only estrogen, only, hormone therapy. In terms of like if you only take estrogen only, even in the big study done back in 2002, if it's estrogen only, there isn't really a risk. It's like they actually found that it may even help someone like have less cancer risk. And if it is estrogen only, like there are some positive benefits that they found in that women's health initiative, okay? But it is still important to note that if you potentially just take estrogen on its own, there could be health risk, like maybe some blood clotting, possibly some stroke if you take it after 60, gallbladder disease, things like that. But again, I want to say that there's different kinds of estrogen that you can take. It's just that estrogen on its own is not as risky as this next class I'm going to talk about. So the next class I'm going to talk about is the second group, where if you do still have a uterus, if you still have a uterus, it's estrogen and progesterone together, okay? So why is this? Because you need to have progesterone there to be able to protect the uterine lining. Progesterone prevents the thickening of that uterine lining. Estrogen thickens it. So that's why you need to take it together, estrogen and progesterone, right? But there is some side effects of progesterone, like mood changes, bloating, some breast tenderness. People who sometimes take progesterone will say they may have some mood instability, again, like some headache, migraines, some of those things, yeah? But it's not across the board. It's just people do report sometimes having some of these symptoms for taking progesterone, okay? So one of the more controversial things is that, in the world, the Women's Health Initiative that they did is they found that the combined estrogen and progesterone carries a small but significant risk of increase in breast cancer compared to estrogen-only therapy. But this is something we want to look at carefully. Obviously, if you read lots and lots of research paper and go through tons and tons, there has been a lot of debate, especially more recent findings from things like that Women's Health Initiative back in the early 2000s, okay? So the thing is, we have to consider that the increased risk of potential breast cancer that they did find with estrogen and progesterone combination, or progestin, which is synthetic, is that it was a small amount of people. It was like, when they did the numbers, it became like 1 in 1,000 people would get this breast cancer. So one of the things too is that it's actually a really small percentage. And another thing that they were really kind of saying is that the average age group of the randomized controlled trials they did in the Women's Health Initiative back in 2002 is that the average age of the women were about 63. So you have to understand, what I'm trying to help you understand is that yes, there's a link between estrogen and progesterone potentially having a higher risk of cancer causing, but we need to look at the fact that maybe back then too, the age range was higher of the women they tested, and it wasn't accounting for the younger population, like 40s and 50s, and as well that they were using synthetic hormones at that time. So it wasn't bioidentical hormones, right? So this is something we want to keep in mind, but it is important to understand that it has been shown that if you are taking some synthetic hormone therapy and that combination, you could have a risk. It's just to help you understand that, but also understand why it's been heavily debated. Okay. Is anybody on synthetic hormones here, or everyone's on bioidentical? Put it below. I love to know kind of who we have here, right? So as well, when you have, the progestin, like when you're taking, this hormone, like it can have some cardiovascular risk, like blood clots, stroke, heart disease. It can increase insulin resistance in your body. Now, as a health coach, I talk a lot about insulin resistance and controlling that through healthy eating, but it could cause some of these things and maybe raise the bad cholesterol, and you could potentially have some irregular bleeding, right? If you take synthetic progestin versus micronized progesterone, which is bioidentical hormone, there is a different effect. They say that the micronized progesterone has fewer side effects, is a little bit more breast friendly, and so lower doses can be tolerated well, right? So again, I'm just helping you understand, is there some risk with taking estrogen with progesterone, or there is, but you need to consider, are you taking synthetic or are you taking bioidentical hormones, and what age range you're in, right? And I'll get more into this in a bit. So another thing is sometimes in HRT, depending on that doctor's comfort level and what they believe, they could also prescribe potentially testosterone, but it is off label. So what I mean by that is actually not FDA approved, and it depends on the country, but United States and Canada do not approve it. Australia, UK, and some other countries do approve some aspects of it, okay? So why would you potentially maybe prescribe some testosterone? Would be maybe low libido, low energy, persistent fatigue. But, there is things you may not want, like acne, hair growth, voice changes. So you want to be careful about that. Usually it's dosed very, very carefully if you have someone working with you on that. But it is something you want to be careful of, because the way the US and Canada, it's not approved. So what they will typically do is they're kind of going to borrow the male products of testosterone, and they're going to give you a lower dosage or use it at a compounding pharmacy and make that testosterone from there. So it's a little bit, dosage and things could be a little bit, maybe not as accurate. Whereas in Australia and UK and some of these places where they do allow for the female kind of prescribed testosterone, they will have specific creations for the female. So they don't have to borrow from the guy's testosterone kind of medications, right? So this is something that it's not as common. Most women thinking of HRT are thinking more in regards to estrogen and progesterone. Estrogen if you don't have a uterus, estrogen and progesterone if you have a uterus, right? So we're more in that arena, but like I said, I've even coached people who do take a little bit of testosterone, so wanted to bring that up. So again, anybody on here, are you guys taking synthetic or, bioidentical hormones? Put it below. I'd like to know if anybody is taking or none. I know somebody said they're taking none, all of that. So I'm going to talk about delivery methods. So there are different types of delivery method for the hormone therapy. So there's oral pills. This is the one that carries the highest risk. And usually, if you talk with your doctor, they should kind of let you know about this. The oral pills, transdermal patches is another one, which means like on top of the skin. The pellets, like my client had, it's like an implant they put underneath the skin that releases hormones slowly over 3 to 6 months. Or vaginal creams, tablets, and all of that, right? So there are different delivery methods, and there is a difference in the risk factor. So this is kind of another nuance, right? Like I said it's not like for sure yes or no, but it's to consider a lot of factors, right? So like oral estrogen or taking something orally is kind of the one that carries the higher risk. And the reason is because it actually goes through your gut and passes through the liver first, right? And so the problem here is when it passes through the liver, your liver reacts by producing clotting factors. So proteins that are more likely to make your blood clot, right? Oral estrogen is probably, I would say probably, again, you discuss with your doctor, but it has much more higher risk. It can also impact proteins. So because the estrogen goes through the liver, it can ramp up proteins like the CRP, C-reactive protein. These are inflammatory molecules, if you follow me for a long time, triglycerides, and even, sex hormone binding globulins, which means it's going to affect your sex hormones. So it can strain your liver, it can cause liver strain, it can impact some of these proteins, and it could cause more blood clots. So usually I think a lot of people choose not to go for maybe the oral pills. So there's other methods like transdermal patches, gel, sprays, which is, applied on the skin, and then it directly absorbs into the bloodstream through the skin. So it doesn't spike any clotting factors, just lower risk, like I mentioned, more stable hormone levels, right? The Women's Health Initiative back in 2002, okay, we're going to talk about this because this was why there's such a big controversy. It was a government funded trial that tested in the randomized controlled trials 27,000 women, okay? They were split into two groups, with one group estrogen only, like I said, and another group estrogen and progesterone. So they had split it into two groups, okay, two arms. And like I said, why people became scared initially there was this report or risk of breast cancer with the estrogen and progesterone, the heart disease, the stroke, the blood clots. And I think a lot of people got a really fearful when this actually happened. And this is why I want to kind of just lay it out for you, is that because so many studies have kind of gone back and debunked a bunch of things, the later analysis of it is a couple of things. One, your age really matters when it comes to hormone therapy, okay? Your age matters in how old are you when you start taking it, right? So the average age of the Women's Health Initiative was 63 years old. So many of these women were 10 to 15 years past menopause when they started HRT. So at baseline, these women were already at a higher risk of heart disease and stroke. So some of the data could be skewed. And some of the later findings and some of the later studies, which I'll talk about some of these later studies, they, between the ages of 50 and 59, like when they were younger, they actually had lower risk of the heart disease and stroke. And sometimes they had the positive benefits, like I had mentioned, because some of the later studies study the younger women versus the older women, right? So yes, the biggest risk are with the group with estrogen and progesterone group. The estrogen only group, like I said, had no increased breast cancer risk in the WHI Women's Health Initiative back in 2002. And then your critical windows, just like I said earlier, is really important. So if you start HRT within 10 years of you having menopause or soon after you are in menopause, you have a much lower risk. If you start HRT more than 10 years past your menopause, when you've gone into menopause, the risk starts to go up significantly in heart disease, in blood clots, in dementia, okay? Now, other studies that happened after the Women's Health Initiative. There was a KEEPS trial in 2012. So they looked at younger women between 42 and 58 within 3 years of menopause. It showed HRT improved symptoms and markers of heart health without the scary risk. So the KEEPS trial, they found the younger population did relatively well. The ELITE trial 2016 confirmed the timing hypothesis I just spoke about, that women who started HRT earlier had less plaque buildup in arteries, and women who started later had more risk, just like I mentioned. And so there's another study called meta-analysis in 2015 to 2020, where they followed these groups of people, consistently show that age and timing are the biggest factors in whether HRT is safe. 5 things I would say you need to consider: age, timing, type, dosage, delivery method. Those are things that will help you understand what kind of hormone therapy would be best for you, should you even be in the qualifying window for HRT or not. And remember, one thing I'm going to say again is you, of course, will check with your doctor in regards to all this. All I'm doing here is helping you understand a little bit more of like the controversy behind HRT and helping you start to think about it for yourself. Okay, now let's talk a little bit about bioidentical hormones versus synthetic hormones. Women's Health Initiative, WHI, okay, they had been testing specifically on synthetic hormones, which is conjugated equine estrogen, CEEs, and the progestin is medroxyprogesterone acetate, okay? So you have to know that these were synthetic hormones that were done in that initiative, and believe it or not, it comes actually from pregnant urine of horses. So the synthetic hormones that were kind of administered back then is, if we had to look at sort of like why people were kind of like, well, it's not fully accurate, especially with now modern types of hormones, is because since then there's been a lot more of the, bioidentical hormones, right? So let's talk about bioidentical hormones. So bioidentical hormones means that the hormone molecule is chemically identical to what the human body makes. Most are actually synthesized in the lab from plant sources like soy or wild yams and so on and so forth. But you won't get like, suddenly estrogen from just eating those things. They have to be created in a lab, okay? But common examples are estradiol, and then of course progesterone will be micronized progesterone. Prometrium is one of the names. So these are more natural, okay? So why am I bringing this up is that I think this is where we have to be cautious, right? Okay, back then there was like super high risk of like all of these negative things and blood clots and cancer. But that was all based on synthetic hormones that were being administered, right? And now with more bioidentical hormones and if you do more patches, not orally taking it, it can have lower risk of blood clots and stroke. And micronized progesterone is shown to be safer for breast issues and a lot of like mood things that I mentioned above, right? And so this is the thing is like, I think I want you to understand synthetic has higher risk. Yes. And that was what the WHI was testing. So a lot of the big fears were maybe inaccurate, and the community and the scientific community and the medical community is pretty on par with this. But the debate is now towards something like bioidentical hormones, because bioidentical hormones are a lot better for you, but it is not risk-free. So this is something you have to still decide whether it is something worth it for yourself. So what's really important is to recognize bioidentical hormones does not mean no risk. Estradiol can still raise risk of clots, especially in the oral pill that I had mentioned. It can still lead to potentially, stroke and gallbladder. Progesterone, even by bioidentical, can still cause some bloating, drowsiness, or irregular bleeding, right? So, the quality of what you take is important. The dosage is very important. The purity of what you take is very important. So, of course, that's why I say, I'm here to help you understand, think, learn about how to distinguish what is going on here. Ultimately, you want to make sure your doctor really knows what they're doing, really understands like the impact it has on your body. Obviously, bioidentical, why it probably is the better route, but the dosage, how you're going to be dosed, and the purity, different things like that. And again, like, will you be adding little bits of testosterone or not? Like I said, that's kind of an off label, but like I said, I've coached women who are actually prescribed, minor dosages of testosterone. And like, what does that do when you add in testosterone, right? So you have a lot of things you have to consider. It's about thinking about risk versus benefit. And if you listen to all the top doctors and podcasters and menopausal doctors, it's always this type of talk, right? with all medication, you will see risk. So it will always come down to, do you believe the benefits will outweigh the risk? And that's why I'm just outlining it here and just being very transparent with all of you that I'm not pro or con. I believe it's individual situation. That's why I believe that's why I decided that, 3 people can win having a conversation with me, because I believe that's the problem, is people take information very black and white from a talk or from something, but they don't go further into the specific areas, like this factor affects this, so therefore you should look at this. That's why I really believe you need to discuss this thoroughly and really understand the ins and outs for the risk benefit discussion. Make sense? The risk versus benefit discussion. Other part of it that I'm going to talk about in a bit is, could it be controlled through actual other methods, other lifestyle factors, other ways of understanding? Because HRT is only one tool. And the way I'm going to help you understand it is, if you were to build a house, okay, you're going to need a bunch of tools, okay? Yes, I think a hammer is going to be pretty important. Yeah, absolutely. But if you didn't have a hammer, you had another kind of tool, you probably could figure something out with it too. You could, and you could also use a saw. You could also, there's different things. So what I'm saying is that just understanding HRT is a tool, and it can potentially help you, but it has some, I have to phrase this very carefully because this is highly debated, it has some risk, okay? So what are the potential benefits of HRT? So let's talk about this. It will potentially relieve vasomotor symptoms, hot flashes, night sweats. It could improve your vaginal dryness or painful sex. It can preserve bone density, lower fracture risks. So make your bones not stronger, but prevent the loss of bone mass. May improve sleep, mood, skin elasticity, and potentially, like I said, quality of life. And that's why a lot of women do choose to go on to it, because they feel their quality of life is so affected, right? And some data suggests that HRT reduces the risk of colon cancer and type 2 diabetes. Again, remember, some data suggests kind of thought process is it's specific to what kind of hormone you take, and maybe the ones with estrogen only, not estrogen and progesterone, right? So again, there is, in a broad sense, there can be benefits to this, but what are the risk factors that you have to consider? So the risk factors you need to consider are potential increased risk of blood clots, stroke, like I said, but it's higher usually with oral estrogen. I already mentioned that. So if you're using a different method, it could be better. There is a slight increase of risk of cancer if you combine estrogen and progesterone together. But like I already mentioned above, that the findings on this had to do a lot with synthetic hormones, that even with the synthetic hormones, it was approximately 8 additional cases per 10,000 women, which is about one in 1,000 women that had this risk. So just understanding, yes, there is a slight increased risk of cancer, but it's not super high, okay? Another thing is, with your combined estrogen, and let's just say, what if you combine estrogen and more bioidentical, like micronized progesterone, right? It will have lower risk for sure. It's been studied, and there's this study. It's called the E3N French cohort study that studied 80,000 women. Okay, they found that if it was estrogen and synthetic progestins, it increased breast cancer risk. But if it was estrogen and micronized progesterone, which is bioidentical hormone, there was no significant risk in the breast cancer risk after 5 years. Okay, so this is just to let you know, okay, yes, findings found risk, but why it was and what you have to consider. And so to come back to this is that if you are past 10 years of your menopause, post-menopause, or you're after 60, it is is said across the board that you have a higher risk profile. It's helping you guys understand. This is my goal, right? I'm not a doctor. You still must get tested and stuff like that. But it's like when you understand the ins and outs and why there's controversy, then you will understand better what is better for your own body, right? Because you're like, okay, where do I sit? What age range am I? Am I doing estrogen only, or am I doing estrogen and progesterone? Am I doing a bioidentical hormone? Does my doctor and holistic doctor, like the previous individual I said was a previous angel, she had testosterone pellets, So that's all going to affect a lot of things in your body, right? So it's like, okay, sit back and think, HRT is not necessarily good or bad. It's contextual, and we need to evaluate this from your specific situation. And that is what a good doctor, a good coach will do, is always specific to your situation, okay? One thing I'm going to say, and obviously this is just, again, to help everybody understand. And by the way, if you are finding value in this, I really love it if you can drop some hearts and you can it really helps me, people see this more, because, it's like you are like, wow, okay, I'm learning so much, or she's finally helping me understand the ins and outs. And I always say, like, don't keep the information to yourself. Try to share it with other people. People in your circle can really benefit. People are really confused about HRT. So press that arrow button, hit the love button. And I appreciate if you share more of this with the people around you. The North American Menopause Society in 2023 and the Endocrine Society, they both agree. So these are big societies, okay? The North American Menopause Society as well as the Endocrine Society, they agree that the best candidates for hormone therapy are women under 60 within 10 years of menopause with bothersome symptoms. And what they meant by that is that if it's like only minor, maybe it's not worth it. But if it's like it's affecting you to the point of your quality of life, then that could be a possibility, right? However, it is not an anti-aging tool, right? It's not a tool where it's like it's going to fix everything. It's just one tool for you, right? Kind of the breast cancer situation, because a lot of people are scared, right? They're like, if I take HRT, will I get cancer, right? So again, to come back to this point is, there's a slight increase in breast cancer if you take estrogen and progestin together, usually after 3 to 5 years, but that's usually with the synthetic side, right? And when do you start to take it? Okay, so there was a study where they were studying like women in the 50s, like I mentioned, and they were studying them taking HRT, and after 5 years of them taking it, there was no major shifts in their risk factors, whereas people with 60 or 60 above found more risk factors for dementia and heart diseases and things like that. So I already mentioned that, but because people are so concerned about that, so I just want to make sure. Anybody here concerned about cancer or have a family history of cancer? So that also plays a little bit into it, right? That can play into a little bit of your decision making as well. It's not the absolute, but it could play into some of the decisions, okay? So what the last part I really want to talk about is, because HRT is just a tool. Like I said, building a house, you can use a whole bunch of tools. It is not the only thing. And of course, as you guys know, I am a holistic health coach. And my area is in helping women, people around me, my own family, understand how to improve their life from more lifestyle changes, more natural-based approaches, if possible, okay? So actually, let's talk about, this is my focus right now, is talking about, okay, I help lay out HRT, why there's a big debate, factors you must consider, and understanding why there was controversy behind the WHI initiative, and understanding synthetic hormones versus bioidentical hormones. At this point, for me, I like to talk about lifestyle foundations. As those who follow me know, that is my lean. Yes, you could call it a bias, but it is something I really believe. And I'm going to explain that because I'm going to give you an example. This is the best example. I have had multiple clients come to me who has had gastric bypass done, where they shrink their stomach. And multiple of them who have come to me have regained a lot of their weight. They are still smaller than where they were originally. And there's different reasons why people would choose to do gastric bypass. However, one of the core issues I saw as a health coach was that there wasn't a consistent change in their lifestyle. When you do surgery and shrink the stomach size, but don't understand the actual lifestyle changes of how to eat, what to eat, when to eat, how to exercise, how to control your hormones and stress levels, those all will inherently impact you, and you will go back to gaining weight. A lot of them gain back 50 to 60 pounds and they're still overweight, okay, despite gastric bypass. And this is just as an example of there is no magic pill. And I would say HRT is not a magic pill, but it is a tool. And if you can understand how to support it, and you change the important lifestyle factors first, this is the foundation, because it's the soil. If you don't till the soil and the soil is crappy soil, I don't care what you put on top of that soil, it's going to not be great. You still might be able to grow a tree, just the tree won't look that healthy, you know? So I want you to think lifestyle foundations as like foundation of the soil. And whether you decide to do HRT or not, you have to learn the right things. And we're going to go through each step on this, okay? First of all, everybody listening, is number one, 70%, 80% of your results will come from nutrition. You're not surprised Clarice said that. And you're like, I know. Yes. So nutrition is super crucial because how you eat will affect your hormone levels. And I always talk about controlling your hormones through proper nutrition. So here are some examples, right? Of one, are you controlling inflammation in your body? Because if you're not learning about what are potential inflammatory molecules or inflammatory things, you could be a doctor. I mean, my sister's a surgeon, you know, and she comes to me and asks me about what's that inflammatory course you have, you know. It doesn't matter what certification or background you are. If you are not cautious of what you're eating or inflammation markers you put in your body, that is a huge risk factor. It doesn't matter if you are on HRT or not. Inflammatory molecules, if it inflames your body, there is a lot of cascading effects in your body, right? Like I said, if you are inflamed and C-reactive proteins go up, and then your immune system fires, and then, you know, your cortisol spikes up. Well, what does cortisol do? Cortisol blunts estrogen and testosterone. If you are already low in estrogen, you're going to get a whack lower in your estrogen just by not controlling inflammation in your body, right? Everybody is susceptible to kind of eating a little bit not great. And we have to be super careful about this. And this is my message here at the end of my HRT live, because I wanted to outline HRT, but there's a lot of things to consider. It could be risky, but it could work for you. Like I said, I'm not pro or con, I'm just laying it out, but I am pro on lifestyle foundations. That is 100% for me, because like I said, if you don't control inflammation markers in your body, your estrogen, your sex hormones are all impacted. Your cortisol is impacted. When your cortisol is impacted, what does it do? It impacts your thyroid. It impacts your insulin, as I say in so many of my lives, right? So if you are listening to this and you're like, I think I eat clean, but you're not really sure, are you really controlling inflammation? I want you to put inflammation below, or anti-inflammation below. And this is something I want people to be honest with themselves, there's a difference between saying, like, I know exactly what are inflammatory molecules versus I think I eat healthy, but I'm not sure, right? So if you want more help with anti-inflammation, understanding specific inflammatory molecules, what you need to be careful of, and a lot of health-based products still have problems in them, and you want to be careful of them. And I said this last time, that sometimes it isn't, when I speak, and I'm very strong about this because this is my expert area, is that it's not that the moment the compound enters your system, it inflames your system. It's the cascading effects, just like estrogen and progesterone and what it does in your body potentially could raise risk factors for blood clots or things like that. It doesn't mean right away. But the thing is, if those inflammatory molecules are not, or the molecule that I'm not approving of is entering your gut system, and it causes microbiome imbalance, and it kills off some of your good bacteria, and it causes dysbiosis in your system, that will eventually cause nutrient malabsorption. Then it will cause hormonal imbalances. It will spike your cortisol, and potentially, this is after a while of eating inflammatory stuff, potentially leaky gut syndrome, right? And another aspect of like hormone balance is adequate protein and adequate ability to stabilize sugar. And in the scientific community, everyone, it's across the board, agrees macro balance is the foundation. Stabilizing your blood sugar, adequate protein, understanding the way you need to balance your macronutrients is super crucial. So this is the part where I would encourage, if for those who are struggling with like the symptoms and the things like I don't feel good or this like mood swings, or is before you jump to HRT, maybe consider understanding, learning about what you really need to know about macros and macro balancing, about what is the amount of not only protein, but carbs and fat, and the types of distribution throughout the day. There is also how you're going to eat throughout the day. And when you don't eat at certain times or you eat in certain ways, you are sending different signals and hormone signals to your body, right? So I would say, if you are struggling with a lot of menopausal symptoms and it is significantly affecting your quality of life, really working on your nutrition is going to be one of your foundational first steps. I'm not saying you can't take HRT, but I am saying that you need to understand, significantly like helped you understand, like, I never knew that there's so many things I need to look out for in my food, right? So another thing for HRT, like sort of like before you go into taking HRT, is also understanding the compounding effect of what you could do with nutrition and exercise. Okay. So again, this is my area of specialty, is that it's nutrition is going to push for 70% of that result, just like I said. But exercise, if you do it well and you understand what to do in that, it is metabolic gold. Yes. You can put it below. Muscle is metabolic gold. Yes, muscle is metabolic gold. If you understand how you need to do certain things and to build muscle, it is going to massively help you increase the positive pro-hormones, which, if you missed my live last week, was it last week? Yes, I was going to ask Oshoni, but my live last week was body recomposition after 40. So again, if you want that, you can put body recomposition after 40. But it's that when you have more muscle, okay, you have more, in that process of building muscle, you will excrete more HGH, human growth hormone. You will excrete more insulin growth factor. IGF-1 is super crucial for women. And it is actually the hormone that will counteract your dropping estrogen. And I'm not going to go into the specifics of this today, but like, if you understand, okay, let's take a step back. Do you have to take HRT? No. Could it help you? Yes. It has shown great benefits, but is there risk? Yes. And so if you want to have a good, maybe a foundational approach first, where you hit all the foundational markers first. Do I have my nutrition in place? Am I addressing inflammation? Am I addressing macro balances in my meals? Am I actually working out in a way that really promotes muscle growth, or am I just working out to work out? What is your goal with working out? Is it to just go to the gym and feel better, or do you actually want results? And I said, so there's a big difference between just going to the gym and actually training for the right result. And so this is kind of where I want to emphasize MTP. I know I speak this all the time, but at least I'm consistent, because I believe in the foundational philosophy. MTP is menopausal training protocol. It means The protocol, I believe, that needs to be there in your training, in your workout, to balance all the hormones as best as possible with regards to understanding how to maximize human growth hormone, maximum insulin growth factor, and minimize cortisol. This is one of my biggest things. So for example, Phyllis is a really good example because her program is nothing like any of you guys, any of you. It's not like yours, Ruby. It's not like Cynthia's, none. I've never built a program like that until we did the reverse aging program for Phyllis. The reason is her situation is so specific. She's 75. She has different issues. Her knee needs a replacement. She has a prolapse. She just has a lot of situations that the last thing I have to do is spike her cortisol, right? So I took a while to build out her program because I'm really focusing on MTP, right? Menopausal training protocol. But MTP is specifically like the way you need to train to create the best balance of hormones for your body as a menopausal woman. I'm going to tell you that this is really important for people who have certain indicators. One, if you have high stress cortisol in your system, and in fact, if you've been tested for high cortisol, MTP really will apply to you. If you have belly fat, this will apply to you because belly fat is telling me, across the board, belly fat is hormonal imbalance. Belly fat is hormonal belly. It has to do with the imbalance of multiple hormones causing the fat to distribute into the belly. So if you have high stress, you have belly fat, or you have really bad menopausal symptoms, MTP is going to be important for you because you need to learn to control these through the normal, natural methods. And then if after all this, I truly believe after you've done all the baseline and still you just don't feel good, you can go and have, the HRT and do the right things with your doctor, but you will feel so good because like I said, like Phyllis, where she learns everything. She learns about anti-inflammation. She learns her macros. She learns all the things and she pairs it with maybe some of the hormone things that she's doing with her doctor so that she can get the best results. My stance is more that if people don't put the foundation and then they jump to HRT without putting the foundation, you could be on HRT and still you will have problems. It's like the gastric bypass example. People have lost, so they do a gastric bypass, they lose on typical, like 3 or 4 of my clients, maybe 80 pounds, sometimes 100 pounds. But then throughout the years, about usually I think between 4 to 5 years, those ladies who come to me, they gain about 50 pounds back. And I'm grateful they didn't gain 100 pounds back, but they gained 50 pounds back or 60 pounds back. And that's kind of my example, is like, if the foundation isn't there, you don't have the right nutrition or MTP approaches, you could go on HRT for the risk of it because you think the benefits outweigh the risk, but you haven't fixed the soil. Does this make sense? Everyone, I'm hoping this makes sense to you. And I just want you guys to understand what I'm trying to help you learn, or the way to think about it, right? The next aspect of, again, why would you maybe not do HRT yet and do more lifestyle factors? So 1, I said nutrition. 2, I said the way you work out, building muscle, MTP protocol. Number 3 is stress management. And I know I referenced it already, but more specifically, stress management is connected to your menopausal symptoms, right? If you have cortisol dysregulation, this can worsen your hot flashes, your sleep, and like ghrelin leptin, I mentioned this last time, right? So you really want to ensure you're in programs that are not just working out. I forget who I was talking to, but this was probably a couple months ago. But they were like, yeah, I'm just gonna work with the trainer at the gym, and I was a trainer for 8 years in the gym. That's how Shone and I met, and I gave her crazy workouts, and that's awesome. But one thing I said to her is like, okay, but you're 55 or 60, and it's not just working out that's going to be the solution to your belly fat and trying to lose 30 pounds and having all these menopausal symptoms. I said, you're looking at one piece of the pie. I said, you need an approach that will look at all of it: holistic, nutrition, muscle building, lifestyle factors, which is cortisol regulation and control. Yeah. So this is where I really believe is like cortisol regulation control means things like, do you have a good rest and recovery protocol? Do you understand proper sleep regimens and micronutrients to take, omega-3s and your vitamin Bs, like really like important micronutrients. But there is a specific, it's called menopausal stack. I said it last time, but those ones are a little bit trickier. So I don't want to get into it like, like DHEAs and like more higher level stuff. But there is more that you can talk about on like specific types of supplementation that can help you control your hormones a little bit better in sort of the sleep and recovery protocol, like not like major chemicals, but just like more natural things that does help you in your body, right? So if you're listening to this, again, you can put cortisol regulation tools or just cortisol if you feel like you really struggle with cortisol. This is, I think, two things. One, belly fat, number one concern women come to me for. Number two, a lot of it is stress, cortisol. Yeah. Put below if you're like cortisol. Yeah. Need to control cortisol. Put it below. I'm smiling because I know a lot of people actually are this. Yes. Having control of your mindset also comes down to connection and community. And this is why, I originally built the Fierce Woman community, Sculpting Powerful Bodies and Champion Mindsets. If you guys know the situation, I'm not in there. I'm not on Facebook. There's been major glitches. I don't have Facebook anymore. So my team is in there though. So that community is still there. But like I said, I'm building a brand new platform. It's very exciting. So if you don't want to miss this and be a part of this new community, there's going to be certain vaults of different things of all my free training. There's going to be revised challenges, and there's going to be a lot coming down on this. So if you don't want to miss this big announcement and be part of a community of women that can support you so you don't feel alone. Why I say that is because a lot of women come to me, they're like, I'm experiencing this. I feel horrible. I feel like, I just feel I have anger up episodes, or I have, and I think that it would be helpful for you to see that maybe you're not alone, that a lot of women do experience these symptoms, but that a lot of these symptoms could be potentially controlled through natural foundational methods before you make the big jump towards something like HRT. But if you do make the jump to HRT, we can support that too, because you can be educated to understand what things do I have to consider before I enter that realm of HRT, right? Then put announcement below so that you can stay connected with a community. So my final message is lifestyle changes are always the first line of defense. HRT can be layered on if needed later. Okay. So that's what I want you to kind of keep in mind. Okay. And also, just like I mentioned earlier, just if you are above the age of 60, because a lot of people who follow me, a lot of my clients are above 60, I would strongly encourage you to carefully talk with professionals, your doctor, possibly me. If you're above 60, just be a little bit more cautious about this whole HRT. There's a lot more risk involved, right? So, there's risk, like I said, like the heart disease, the strokes, the clot, and, can trigger some plaque instability. So this one I'll explain. I explained it once before. If you're above 60 and you've had more than 10 years since post-menopause, that means that plaque could have built up on your arterial walls. So why this could be dangerous is that if you start taking HRT, the HRT can break down the plaque in the wall, and that's where it will potentially cause like the blockage. Yeah. So there's a lot of science behind why this potentially is a problem, of why later in life, if some people have early menopause. I had a woman today message me in my Instagram, and she had her menopause in her early 30s. And she's in her 60s now. And she's not interested in HRT, but I would say probably every doctor would be like, no, right? Like, the amount of time that has passed for these things and your arteries hardening and different things, and suddenly you're going to push HRT in, you're going to cause a lot of instability into your potential arteries and things like that, right? So just so you understand that. And the last thing here is that, like I said, the key to menopausal health is balance. okay, is not taking one thing and being like, that's the only thing. As a menopausal woman, you have to look at things from a holistic perspective, from everything from the nutrition, inflammation, macros, to the way you work out, to MTP protocols, to are you boosting growth hormone and insulin growth factor maximally in the gym? If you only have, Ruby only is a busy mom, she only has 45 minutes in the gym, or whatever, she needs to maximize that workout as much as she can. Does she have proper rest and recovery protocol? How is her mindset? What is her lifestyle factors? How does she recover in between? All of these things that I mentioned is like this circle is more important to really look at honestly for yourself before you make some big decisions in medication and HRT. And if you've gone through all of it, you've done the right thing, awesome. Then you know that, okay, now I can support it with a little bit of healthy, maybe like more bioidentical hormones or something like that. Right? If you are listening and you want to learn more of the balanced approach, which is my approach, it's my lean is this lifestyle foundation, like balanced view for menopausal women. Put balance below. Okay, put balance below. Be a battle cry for yourself. Maybe you need to think about, am I balancing enough? Do I care? Like maybe I'm stressed too much. Maybe I work out a lot, but I'm not good enough with my nutrition. You know what I mean? I hope to always add value. That is always my prayer before I go out live, is that I can add as much value to the women, because I know that it's a gift to be able to speak to all of you, to help you on your journey. So thank you for all of you for plugging in. If it helped you, please hit the heart button and share it to your story so that people can come. Awesome. Enjoy the rest of your night. And yes, thank you, everyone. Thanks for tuning in to the Fierce and Fit Mentor podcast. If you enjoyed this episode, be sure to hit the follow button on Spotify, subscribe on YouTube, or wherever you're listening so you never miss an episode. If something in this episode resonated with you, please leave a review or share it with a friend who'd love it too. Your support means the world and helps us reach more amazing women like you. Until next time, stay fierce, stay fit, and let's keep building your most powerful self.